Hey there friends, it's Dr. Russ, and today we're going to work a little bit on our pelvic floor. This sling of muscle that hangs down from the pelvic ring, holds our pelvic organs in, controls our bladder and bowel. Obviously, really super important. We can't live without it. We all have one, and most of us carrying a lot of tension in it. If you have pelvic pain, hip pain, lower back pain that hasn't been figured out and isn't going away, this video might really be good for you because we're going to focus on sensing, softening, and relaxing our pelvic floor while we bring our hips and lower back through ranges of motion, engaging our glutes and adductors in all kinds of different ways, but focusing on the pelvic floor. For this series, you're going to need about 15 minutes and just a mat, no special equipment required. I recommend you do this as often as you can. Every day is not too much. I do appreciate you watching. I hope you enjoy it and learn from it. Always appreciate your comments and feedback. I try to respond to everyone who comments on my videos. Thanks so much. Let's get into it. All we need for this series is a mat and a little bit of space and a little bit of time. So go ahead and start sitting on your mat, legs in front of you. Doesn't matter if your knees are straight or not, but if they can be, go ahead and let them come straight. Lean back on your hands and just sort of settle in here. Nice deep breath, and setting our intention to relax the pelvic floor and feel it. Spread your heels out just as far as they comfortably can go. And I want you to start by rolling your feet and legs to your left, like this. Keeping your shoulders more or less looking forward, come back to center, roll to the right. So as you roll to the right, your left hip comes up, roll back to center. As you roll to the left, your right hip comes up, come back to center. What we're doing here is starting to spin the ball of the hip in the socket of the hip. And in doing so, we're stretching those little muscles that communicate and connect the thigh bone to the pelvis. And those are, if not pelvic floor muscles themselves, intimately connected to the pelvic floor and very, very important. Okay, let's come to the left one more time. So kind of like rolling on to the outside of the left hip, the right hip comes up. Now you're going to take that right hand, put it on the left knee, and turn. This will bring the stretch up into the outer glute, a little bit of the hamstring on the left side. Lean over that left hip and bring that stretch into the glute. Come back to center. Okay, so we roll to the right, pick up the left hand, put it on the right knee. Roll a little more to the right, get that stretch into the right glute. Lean over that right hip and really bring that stretch into the glute, okay? Let's go again to the left. Hopefully you're getting the hang of it. Just like this. See that right knee just kind of rests on the floor. It's not about how flexible you are. This is not so much a range of motion movement as it is getting awareness of these muscle groups by giving them a little stretch. And with that stretch, we get sensation. And with that sensation, we get awareness. And with that awareness, we get the option to relax, okay? So we're gonna do that again, only this time, you're gonna focus on the pelvic floor. On the pelvic floor. Right behind the genitals, right in front of the tailbone, right there in the center of your groin. That's where you're gonna focus while you roll over to your left and keep that pelvic floor soft and relaxed while you stretch that left glute. No contracting in the pelvic floor here. If you feel yourself start to contract, back off a little bit, relax, and see if you can move into the stretch without contracting in your pelvic floor. Wherever you feel this stretch is great. You might feel it in your lower back, you might feel it in the outer hip, you might feel it in the hamstring, you might feel it in the groin on the opposite side. What matters here is that we're getting a full spin and roll of our hips without any pelvic floor effort at all, and no pelvic floor resistance either. Nicely done. Bring those feet flat, knees bent. Separate your knees and let that right knee drift in and up. And then the left side. The knee drifts in, the knee drifts up. And there may be a tendency to initiate the inward pull of that knee from the pelvic floor, from the muscles that hold in your pee when you have to pee. But we don't want to do that today. We want gravity to do this with a little assistance from the adductor muscles in the thigh. No pelvic floor, no squeezing around the genitals is happening here. No Kegels are happening here. In fact, as the adductor comes in and the hip swivels in the socket, we get a little stretch of this little muscle. It's one of those connecting and communicating muscles called the obturator internus that connects the inside of the pelvis to the outside of the hip. It's a very interesting, fascinating little muscle, and we're saying hello to it, making sure it stays nice and relaxed. One more time. Right side. And then the left side. Good. For this next piece, we're going to do some bridges, so get on your back. Feet flat, about hip width apart. Take a minute to connect to your feet. Nice and relaxed, flat on the floor. And then connect to your pelvic floor. There should be no squeeze. There should be no Kegel happening. Everything is relaxed, as if we're just going to let everything settle toward the floor and like make as big of a dent in the floor as we possibly can, okay? So what we're going to start to do is pushing through the heels to lift the pelvis. So this is a simple bridge. It doesn't really matter how high we go, okay? Just going to do a few simple reps of a bridge, up and down, just like that. And I want you to notice as you're doing it, are you squeezing your pelvic floor while you do this? Let's try keeping that pelvic floor relaxed and open, pushing through the heels. The sit bones stay wide. There's nothing to squeeze inside the pelvis. This is hamstring and glute action, a little bit of abdominal action, lifting our pelvis up off the floor and keeping that relaxed as you slowly descend and place your pelvis on the floor again. Lift and lower. Let's take a moment here to do a Kegel. Squeeze that pelvic floor, relax. Squeeze your pelvic floor, relax. One more time. Squeeze, and then relax. And again, if you're not getting in touch with this, start with my other video of sensing your pelvic floor. Now, keeping that pelvic floor relaxed as you lift and lower. You're really not squeezing your butt cheeks on this either. All your butt, everything there is just kind of hanging loose like a hammock. Just like that. Okay, now go ahead and roll onto your left side. You can prop up on your elbow, or you can put your head on a pillow if you want, whatever's comfortable for you. And we're going to practice using our adductors, keeping that pelvic floor relaxed. So we're going to lift and lower the right leg 6 times. Feeling softness in the pelvic floor. All the effort is coming from the side and back of the hip. There's no squeezing going on. Everything is relaxed. One more time. Set it on down, and let's switch sides. You're doing great. Propped up here. Check with your pelvic floor. It's relaxed. No squeezing. And without squeezing, we're lifting and lowering. This might feel easy for you, in which case, that is awesome. Do 3 more here on the left. Relaxed pelvic floor. It can't help. Awesome. Let's come into what we call a Z-sit. So a Z-sit is like this. I'm sitting on my left hip, my left knee is bent. The arch of my left foot kind of snuggles the top of the right knee. The right foot sits behind me. So I'm kind of in the shape of a Z. And you want to rest on your left hand, right hand on the right hip. And what we're going to do is start to roll the right hip forward and back, just like this. Now this is an opportunity to really feel some differential movement between the ball and socket and the pelvis itself. And you want to feel that sit bone kind of curving behind you. You want to feel as you rock forward here, the pubic bone is rocking toward the floor, and relax. You might feel a little stretch in the left glute. You might feel a little stretch in the right psoas, hip flexor. Either way, it's okay, or neither is fine. What we're feeling for mostly is deep in the groin, up under the sit bone, up under the pubic bone, some movement. Some relaxation and a very gentle stretch and opening of the right side of the pelvic floor as the right hip comes forward. There's no pelvic floor contraction that's happening here. It's staying totally relaxed. Okay? To switch, stack your knees, come into a butterfly, stack your knees on the other side, and bring that left knee to snuggle into the arch of the right foot. Lean on the right hand and roll. So yeah, we're kind of rolling on the right sit bone, rolling back and forward on the right sit bone. The pubic bone scoops under. The sit bone kind of flares out behind you. There's a lot going on here. It's a nice little stretch for the left side of the pelvic floor. I'm having a temptation to kind of squeeze my left pelvic floor as I do this, especially as I come into the forward phase of this movement. And so it's taking some effort for me to stay relaxed around my perineum. And that's good. That's exactly what we're going for here. That's the sensation we're training ourselves to feel. And I hope you're finding this useful as well. Let's do 3 more on the left side. 1, 2, last one. Gentle, perineum relaxed, pelvic floor relaxed. Good job. For the next piece, we're going to go on all fours, hands and knees. We're going to work some cat-cow. And this is a really good opportunity to really feel that pelvic floor spread and open. So on hands and knees, feel free to come onto your fists if your wrists prefer. What this is really all about is feeling the pelvic floor open as you gently come into the cow. So the tailbone comes up, the sit bones face the ceiling, and as your sit bones come up to the ceiling, also think about them spreading wide. You might find it useful to bring your feet a little wider than your hips, right? So you internally rotate those hips, and that'll help cue you into opening your pelvic floor and feeling those sit bones widen. Sit bones kind of come together here, and then as you arch into the cow, the sit bones widen and come up. Now coming into the cat, where we curl under, it's our abdominals that do this work. You might be tempted to squeeze your glutes in your pelvic floor. Try not to. Okay, the point of this movement is to see, can we come through a full arch and a full curl of our pelvic floor, of our spine, without contracting our pelvic floor, without squeezing in the butt, without squeezing the perineum, because the tendency would be right here to give it a squeeze, right? And try and get a little further into that cat position. And that's okay, but that's not what we're going for today. Today we're going for relaxed pelvic floor. And let's do a couple more. The cat. Feeling that pubic bone here coming between the thigh bones as the sit bones open. And then the sit bones coming toward the thigh bones as the pubic bone comes up toward the sternum, keeping all that relaxed. Last one. Really good. Full cow. Sit bones wide, pointing to the ceiling. Full cat. Pelvic floor relaxed, pubic bone up. It's the abdominal muscles that pull you into this arch. Come back to neutral. And keeping that pelvic floor relaxed, slide the right toes behind you. See if you can lift that right foot. Try to stay balanced and not shift the weight to the left leg. Let's do that again with the right foot. The right foot slides back and lifts. Try not to shift the weight over your left leg so you can engage the lower abdominals on the right side and make sure you're not squeezing your butt or squeezing your perineum. Anytime your wrists need a break, give your wrists a break. Coming back to neutral. There's no arch here, there's no cow, there's no curl, there's no cat. We are in a neutral spine, as flat as you can. If there was a dinner plate on your back, you wouldn't spill any gravy. And we're going to do our left foot twice. The focus here is a little bit on strength of the glute and the lower abs, but really today we're trying to feel that pelvic floor staying relaxed and loose as we put our hips through some paces here. Right side twice again. Up, down, right side, up, down, left side twice. Bringing it up, bringing it down. The last time. Well done. Come into a seated position, low kneeling, crisscross applesauce on a chair, whatever you like. Hey, it's Dr. Russ. I really appreciate you doing this with me. I really hope you find it helpful. Chronic pelvic pain from pelvic floor tension can be debilitating. If you're suffering with that, my heart goes out to you. Feel free to reach out to me. I may have resources for you. We can do telehealth, or if you're ever in the Portland area, you can come and see me. Always be happy to see you. As always, this is Dr. Russ out. Hope you have a beautiful day.